What is a gastric bypass surgery? Also known as Roux-en-Y gastric bypass, this is a weight loss procedure that combines a restrictive and malabsorptive mechanism to accomplish weight loss and metabolic changes. It is called a bypass because the procedure involves connecting a small pouch of the stomach to a distal portion of the small intestine. This causes the ingested food to pass directly from the new stomach pouch to the small intestine, bypassing a large portion of the gastrointestinal tract and impairing the body's caloric absorption. The bypass is usually recommended in obese or extreme obese patients with health issues related to their weight, such as type 2 diabetes, high blood pressure, obstructive sleep apnea, high triglycerides, high cholesterol, heart disease, infertility, etc. How does a gastric bypass surgery work? Gastric bypass works on a 3-level to help patients lose excess weight. It restricts the amount of food that a person can consume, the restrictive component. It limits the number of nutrients and calories the body can absorb, the malabsorptive component, and it reduces the levels of certain gut hormones, slowing the hunger sensation and increasing satiety after eating. This is the metabolic component. How is the gastric bypass performed? As the gastric sleeve, the gastric bypass is performed using a laparoscopic technique, which consists of using small incisions instead of a more invasive open surgery. Through the incisions, the bariatric surgeon reduces the size of the functional part of the stomach to the dimension of an egg. Next, the surgeon creates a small opening, which is called stoma, between the stomach and the intestine. Then, a distal section of the small intestine is attached to the small stomach pouch. So, any food bypasses the part of the small intestine that is responsible for absorbing nutrients and calories. After having gastric bypass surgery, the smaller stomach pouch allows individuals to feel full after eating only a small amount of food. Also, the stomach causes a delay in the emptying of the stomach, so patients feel satisfied longer. Finally, because of any food consumed by the patient bypasses the absorptive section of the small intestine, the body absorbs fewer calories and nutrients, leading to weight loss. Life after gastric bypass surgery. Gastric bypass surgery can change your life for better, but it is a serious undertaking with a slow recovery process. Although you'll be able to return to work after 1 week after the procedure, you must adhere to an only liquid diet for several days following the surgery. With the help of our bariatric nutritionist, you will be guided on how to incorporate solid foods into your diet. For the rest of your life, you will need to eat smaller portions of regular foods. I hope this information has been helpful to you. If you have any questions, do not hesitate to contact our team at bariatrics@vidawellnessandbeauty.com. We are happy to help.